Live from our studios in Kokomlimle on the Fanofa Street. Coming up this morning, IMF bailout won't immediately end Ghana's difficulties. President Kufuor tells Ghanaians in his last COVID-19 address to the nation. We have excerpts in case you missed last night's broadcast. Impregnated and infected with HIV at age 12 for want of sanitary pad will tell you the sad story of 12-year-old girl. And the Bole District Security Council set to hold a meeting over the boat tragedy, which claimed one life, leaving several others missing. We're live in that community for an update after 6 people have been rescued, treated, and 5 discharged. We have details plus a sneak peek of the ongoing swearing-in of Nigeria's President-elect Bola Tinubu. Stay with us for more. President Kufuor has emphasized that the bailout secured from the IMF will not be an instant panacea for the country's challenges. He believes it will nonetheless play a crucial role in restoring confidence and reopening opportunities that have been limited in recent years. During a national address on Sunday, the president acknowledged that the approval represents a positive step toward putting the country back on track.
The International Monetary Fund has been most supportive, and we have ended up with having our program approved in record time, culminating in the formal approval by the IMF board on 17th May. As I'm sure we have all heard by now, the details of the program have been explained by officials of the fund and by our Minister for Finance and the Governor of the Bank of Ghana. The first tranche of $600 million United States dollars has been credited to our national account out of the $3 billion United States dollars that we have negotiated to receive within a period of 36 months. Fellow Ghanaians, access to the IMF facility will not spell the immediate end of the difficulties we are in presently. But the fact that we've been able to negotiate such a deal sends a positive message to our trading partners, creditors, and investors. A positive message that will be underpinned by the discipline, hard work, and enterprise with which we execute the program. It should lead to the restoration of confidence and the reopening of avenues that have been closed to us this past year and a half. It should also lead to the resumption of many of the infrastructural projects that have stalled.
Kufuor further highlighted that the IMF agreement would aid in restoring confidence in the Ghanaian economy, which has been adversely affected by the COVID-19 pandemic and the conflict in Ukraine.
We got ourselves out of a pandemic in which there were no precedents on which to rely, and where even the experts admitted they had no clear-cut solutions. We did it by being resolute, being focused, and working very hard, and by accepting that we had to stick together. With a similar frame of mind and attitude, we shall overcome the economic difficulties as well, sooner rather than later. I have no doubts at all in my mind that we are on the right path, and we will soon start to see significant improvements in the economy and in the living standards of Ghanaians.
May 28 is World Menstrual Hygiene Day, commemorated with the objective of combating what has been termed period poverty, a state of girls' inability to afford sanitary pads during their menses. Today we'll tell you the story of a girl who was defiled, impregnated, and infected with HIV for want of a sanitary pad. There's more in this report.
I wanted to go out to eat, and then I realized all the boys were like, hey, hey.
At age 12, Afriyie had to move in to live with her aunt in Techiman, where she was enrolled in a school. It was at the school she first had her menses, something she lacked knowledge about. She soiled her uniform, and boys in her class made fun of her. This was the beginning of her shattered life because she had no access to sanitary pad.
I used a toilet roll to cover that place, but because of the experience that happened, I didn't want to go out, so I didn't want anyone to laugh at me. So this guy, I was very young, so when I used the tissue paper, he saw me and then he was like, Adebia Kawechi. The tissue, I think the blood overflowed in the tissue, and then he made me wash.
Why didn't you go home? Why did you follow him to his house to go wash yourself?
I saw him as a father figure. So when I told him what is going on, he told me he'll give me 150 pesos to school, and then when I'm menstruating, he'll give me a pad.
But this was a bait. Afriyie agreed to the man's proposal to come out of the shame she had to endure anytime she was in her menses. She was defiled and later got pregnant at age 14. During antenatal, she was tested HIV positive.
I was 5 months pregnant.
Wow.
So my mom asked me who. I told her it was the guy. When my mom called him, he told my mom he doesn't know me anyway.
He doesn't know you from anywhere?
He doesn't know me. That he's not the cause. So we went, whenever I go for antenatal, there was this time they told me to go for lab, and then I realized I was HIV positive. We did the test for 2 times, and it all came out positive. At that moment, I blame my mom. I told her it's her fault. Why did she get sick for me to go there and then something like this to happen to me? And then she was encouraging me that they said there's drugs there, that's not the end of the world, and then all that. But in my mind, I told myself I'm not going to take the drug. I'll just wait for death to come and take me.
Unfortunately, such cases of abuse and defilement are not reported for appropriate redress. Afriyie, now 19 years, could not further her education after completing junior high school. She believes she would not have fallen prey and suffered such ordeal if she could access sanitary pad at her tender age.
If anybody had supported you with sanitary pads, genuinely, without any strings attached, would you have had sex at that age of 12, 13?
No.
You're sure?
I wouldn't have had sex, because even when my auntie wasn't giving me food, I had friends who support me with food. So if I had gotten the pad, I wouldn't even think of
sex.
Yes, because that was the only thing that I saw, say, yes, I should do it, since it's saving me from disgrace and then all that. Why don't I do it?
In commemoration of this year's World Menstrual Day, Love FM in Kumasi will be donating boxes of reusable and disposable sanitary pads to schools in deprived communities in the Amansi Central District.
Well, in the last few hours, some CSOs are getting prepared to petition the president to remove taxes on pads so that it will be cheaper for everyone to be able to afford it. Let's share extracts of that statement that has been issued by the CSOs with you. And it says, on behalf of the Alliance of Feminist CSOs, AFSOs, we acknowledge the celebration of this year's Menstrual Hygiene Day. We call on girls to keep hope alive in the face of the numerous challenges being confronted with regard to menstruation. In the face of the harsh economic conditions coupled with heavy taxes on sanitary pads brings to the fore the question of affordability. So far, the January 2022 date, the sanitary pad has jumped from 5.5 cedis 50 pesos to 25 cedis. However, suppliers have attributed the increase in prices of sanitary pads to high taxes emanating from the government. Below are tax components on sanitary pads alone: 20% import duty, 0.5% ECOWAS levy, 15% network charges, 2.5% NHIL, IRS tax deposit, 0.75 exim levy, 2.5% network get fund, 15% import VAT, 0.4% processing fee, 2.5 network NHIL, 2% special import levy, 2.5 get fund import levy, 1.0% inspection fee, 1.0% COVID-19 health recovery levy, and 0.20% African Union import levy. As part of this year's observation, we call on the government to abolish all forms of taxes on sanitary pads. It has also been reported that high prices of sanitary pads could have dire consequences for millions of girls, further impacting their health and dignity, driving them to have transactional sex with older men and ultimately worsening gender inequality. As means towards making sanitary pads accessible, available, and affordable, we call on government to abolish all forms of taxes on sanitary pads. We also call on government to make available wash facilities at various public facilities, especially in schools, in order to ensure hygienic conditions during menstruations. And it's signed by Sheila Adams. She's the Secretary and Administrative Officer, and also Alimato Ishaku, Executive Director of the Alliance of Feminist CSOs. I've been joined right now via Zoom by founder of EcoMe and Rural Girls Ghana, Amdia Abdul-Latif. It's an NGO that help girls in rural areas to actually deal with some of these challenges in terms of their menstrual period and also ensuring that they ensure hygienic conditions. I'm grateful for your time, Amdia.
Thank you so much, Aisha.
Amdia, throughout your rounds in the rural areas, what have you found that is so disturbing, and the reason why these CSOs are calling for a reduction of taxes on sanitary pads?
Okay, so Aisha, this is a very sad reality we are facing in Ghana, and as a matter of fact, the whole of most places in Africa, across Africa. So sadly, women and girls lack access to sanitary pads, information, and even facility to manage their monthly menstruation, which does not only affect the quality of their education and health, but actually impacts the national economy at large. So vulnerable populations, especially poverty-stricken communities where I work, they are, because of the poverty and inequality.
All right, so
the issue is quite serious, and it is actually leading some of these young girls into very serious consequences, like what you mentioned, transactional sex, which is
All right, so this is Amdia Abdul-Latif. She is the founder of EcoMe and Rural Girls Ghana. It's an NGO that deals with girls in rural areas. We'll try and get her back to speak to this issue. But whilst we wait for her to do that, we can move on to other stories. Obuasi Municipal Education Directorate has been recording high absenteeism among girls during the period of menstruation. The number continues to surge due to the rise in costs of sanitary pads. Municipal Education Director George Alfred Kumsin says the challenge puts girls in a disadvantageous position, and Aljima has more.
In Ghana, sanitary pads are subject to 20% luxury tax and 12.5% in value-added tax. This has contributed to hike in prices of sanitary pads, making it inaccessible for girls from poor homes. For this reason, most female students in their menses are forced to absent themselves from school, negatively affecting their studies. George Alfred Kumsin is Obuasi Municipal Education Director.
It is not all the girls who have money to buy pads when they menstruate, and some of them resort to using unclean materials during their menstruation. And some girls, when they menstruate, because they don't have the pads, some of them take excuses to go home.
To deal with the challenge, the Rotary Club of Obuasi has established a pad bank. This is in partnership with other non-governmental organizations, including the Self-Love Foundation, Girls Shall Grow, and Gold City Mummies. A member of the Rotary Club, Delphine Boglovo, believes establishing a pad bank where philanthropists can regularly donate will ensure sustainable supply of sanitary pads.
When we do the one time off, some of the girls we give them, they don't really need it because their parents can't afford it. But we have girls who are really in need and cannot afford a sanitary pad. So the pad bank has been established and launched today. Now the girl child coordinators in the various schools in Obuasi and its surrounding will identify these needy students and then will come and withdraw pads from the pad bank periodically.
The executive director of Girls Shall Grow, Louisa Amwa, called on government to intervene in making sanitary pads accessible to girls, especially those from deprived communities. She said it is unacceptable to have girls skip school during menstruation.
We believe that the government can come in to support by taking taxes off the sanitary pads. At least once the taxes have been taken off, it's going to come at a lower cost for them to be able to afford.
For Joy News, Nanaya Ojima.
Let's go back to the NPP headquarters where Samuel Mbora is pitching camp for us. We are told their Greek minister's supporters are there to pick nomination forms for him. Mbura, what can you report from where you are?
So, Asha, as we speak now, the supporters of the former Greek minister, Dr. Afriyie, are here at the party head office in their numbers, and what they are here to do is to pick the forms for him. So we've had their leadership moving into the party office to pick the forms at the cost of 50,000 Ghana cedis, and after that they'll move to his campaign office at Ridge. But let me just find out from them. They are mostly market women who are here to support. I spoke to them earlier, and then their point was that he has been able to help them get food in the markets, a reason they are supporting him. Madam, good morning. Thank you very much for joining us on Joy News.
Oh, thank you too.
Me pacho adentina ne wan kwa ejuma na wabaha.
Oh, me pacho de ntia mama nkwa ejuma ne se Honorable Osaya Koto, a Greek minister. Pacho onu tina ne man kwa ejuma. Ejuma dia wa ya boa Ghana man. Enu tina man kwa ejuma ne. Obaye no obaye minister no. Wa ma nnuane ebu nkankan odododo constituency eya agbogbo shi ho side no. Ye body ebu ba yile bu ba nchi ebu na se na kontomre ho odin pa enso se tie ni nyina bia ba tibitimu se papa no ye adwuma den de aboa o my Ghana enti ye pese eto aba ne ma no se de be obedi so a aduane bebu o Ghana hanom na ekom enkode yen covid ba ye say na aduane ho odin pa enso yetimi adidia kopem by this time enti Osaya Koto wa ya ade papa enti sremo odododo ofu amobaye abato ne du so amkotoma Dr. Akoto Osei.
All right, so Asha, she is saying that Afriyie has been supportive to the market women, a reason they are all here. But let me also find out from him. Please, where are you coming from?
Coming from Kolegono.
Kolegono. Why are you here?
I'm here because of Honorable Osaya Koto.
So why are you supporting him?
I'm supporting him because he has been able to provide enough food for the country. Even when we went through the COVID, there were many countries who were lacking of food. But Ghana, we did not see such situation in Ghana. He has done very well so that Ghanaians have been getting enough food. Though the prices has gone up, but we have all the food that we need for our
Are you any of the maybe polling station executives, yes, or who are you in the party?
I'm executive organizer in the Kolebu constituency.
Kolebu constituency. So he's one of the organizers at the polling stations. Let me also find out from you, where are you coming from? Why are you supporting Dr. Afriyie? Also free info.
Kolebu.
Kolebu. I didn't know supporting him.
Many people and also be a Greek minister. And who said you might be for so a year fine. Until I'm the man who are better naturally.
And I also offer him for side.
Odo
constituency and a DM pan and my supporting him.
Me support papa no sense obey agric minister no ye hu ni modern bo e wo agric side no nti ye gitum se to aba no ma no obey o manpanyin a obey de chen so se de be ya o man no en laki duane e wo Africa.
All right. So Asha, basically they are all supporting him because they think he's the competent person to lead the NPP, and if he's given the nod as a president, he will do better. So that's the general mood here. We are waiting for the leadership of the group to come and address us after picking the form. So right after here, we are going to a campaign office of Dr. Afriyie at Ridge, where he'll be addressing the media. So if the team from Akoto Afriyie picks the form, it brings the number to 5. We know very well that last week Friday, we had 4 people coming to pick the forms from the Adai Nimo camp. We also had people coming from one of the leading members of the NPP, talking about the former General Secretary of the party, Kwabena J. Japon. We also had Dr. Kwadwo Afriyie also having his team coming through to pick the forms, not forgetting the former Energy Minister, Boache Ejako. So the party says they expect about 9 people to come and pick their forms. Because they have shown in their posturing that they are interested in the race, and that's what the chairman told me last week. So we are still pitching camp at the NPP headquarters here to monitor the developments and bring to speed our listeners what is happening so far as the presidential race in the NPP is concerned.
So Mbura, how many have picked so far? 4?
Yeah, so after the Afriyie's team, that'll be number 5. Last week Friday was 4, so today with Dr. Afriyie coming in, that'll be number 5.
Samuel Mbura is our man at the NPP headquarters. You may know that by now that we have more than 5 people vying for the NPP slot to lead the party in 2024. We're looking forward to the others also picking nomination forms, and we'll be bringing you all that you need to know from there. But the deceased from last Thursday's engine boat tragedy on the Bui Dam at Bongase in the Bono East Region has been identified by her relatives. The deceased, who was among 6 other occupants, fell into the Bui Dam at Bongase, leading to her death and the injuries of other 6 occupants who have since been treated and discharged from the Bongase Government Hospital. But the boat operator, Prosper and Swano, is said to still be on admission at the polyclinic in the Savannah region. Isaac Nonya is our correspondent in that region. He joins us live with more. Isaac Nonya, what's the latest from there? I mean, I'm talking about survivors. What can you tell us about them?
Yes, like you rightly said, all the 5 have been discharged, and then the one who is the boat operator is still on our mission. We get told this morning that they are most likely to refer him to a teaching hospital for a tertiary, medical attention. And also the rescue team led by the NADMO officer of the area, Bashar Adam Hassan, they are moving to the community closer to the disaster zone, and to see how they could talk to them to move mostly away from where they are staying. And also, according to him, there is a need for them to talk to them because psychologically they will be traumatized based on what has happened. The relations of the deceased, who are equally among those people staying by the riverbanks, were able to identify the corpse as one of them. And we are told that
Isaac Nonya is on the line. There seems to be... hello, Isaac. Are you still there? All right, he's our correspondent in the Savannah region, and he's giving us update on what has happened. Let me bring in NADMO officer Bashir Adam Hassan. He's for the Banda Ahinkro district and the district chief executive for Banda Emmanuel. I'm grateful for your time, gentlemen. First, I understand that there's going to be a DISEC meeting this morning. What will that entail? I'm sure NADMO will be part of that meeting.
The whole issue is about...
Hello, Bashir.
Yes, sir. Are you hearing me?
Okay, yes.
Yeah, okay. As I think you have a detail of the accident that happened at the Great Lake. And the whole issue is we are now looking forward that how we can manage to stop further of such nature. Because the river is just an open place where the boat can pass everywhere, where the fishermen can pass everywhere. You can have a specific place where you will pass through.
Hello, Emmanuel. Emmanuel, kindly reposition. I'm very much interested in what you're telling me. Do we have Bashiru from NADMO? All right. So if we have Emmanuel Akone, who is DCE for Banda, do we have you back? All right. There seems to be a connection problem there. Isaac Nonya, are you also back? We would have to... hello, Emmanuel Akone, are you back?
I'm on the line.
Great. So you were telling me about the situation, how it's been handled so far.
Yeah, really. Well, what we are talking about, I have spent my security with the police, people there, and we have a navy in that area. So they all combine together to able to save life of others. And now we are now trying to see how we can manage in such a way that future occurrence will not happen again. So that's what we are looking for. So the dancers will mean to see the way forward. Those who have technical know-how, technical knowledge in that sport will also educate how we can manage to stop future occurrence.
So today there's going to be a dissect meeting. What time is it, and what is entailed in that meeting?
Really, on that meeting, the time now we want to have it around 1 o'clock. Besides that, what we are looking for is we have so many data issues which will be handled. But that river issue, that lake issue is also part of it.
Okay. And we've been trying to reach NADMO, but what can you tell us about NADMO's presence in the area?
Yeah, NADMO is working well in the area. Besides that, now, they also want to know how best they can also handle and give me the report. So today I asked them to give the report to the data, then we all deliberate on it.
Emmanuel Akone, I'm grateful for your time. He's a DCE for the Banda area where this tragedy happened. Now, the Ghana Library Authority has trained young people in the Bono East Region on the concept of entrepreneurship, the role of entrepreneurs in national economic development, business plan development, and financial management, among other things. Head of Corporate Affairs at the Ghana Library Authority, Angelo Sejan, says the move is to, among other things, encourage the youth into setting up their own businesses to reduce the unemployment rate. And Asabit has more.
The Entrepreneurship Reimagined program, organized by the Ghana Library Authority and supported by UNICEF and the Youth Employment Agency, seeks to support self-employment and self-scale entrepreneurship, as well as create and improve alternatives to wage employment. Speaking at the Bono East Regional event held at the Techiman Municipal Library, Head of Corporate Affairs at the Ghana Library Authority, Angela Osei-Jan, says the move will help provide the relevant resources to overcome the entrepreneurial knowledge gap.
As a dynamic institution like Ghana Library Authority, we are trying to solve community problems such as unemployment and underemployment. And so we are making this knowledge available to people who want to start their business or who want to have an extra source of income so that they can also get the knowledge and put it to use to benefit others and also take the weight of government. So we make these opportunities available for graduates, for students who are in the universities to also have a motivation to also set up their business and employ their colleagues.
Regional Director of the Ghana Library Authority, Mrs. Charlotte Nsinya-Tebiri, expressed satisfaction with the program and appealed for more of such engagements, adding that more needs to be done to help the youth create their own businesses.
As one of our resource persons said, most of the youth complete school and they're all looking for white-collar job. And this we have come to realize that we cannot all get a white-collar job. The government cannot create employment for all of us. So there's the need for us to have our own businesses. How do we start our own business? How do we register our own businesses? And that is the essence of the entrepreneurship reimagined that we have today. I'm very excited, and I hope we could get more sponsors to organize more of these programs. They are excited, and the interaction, people are asking questions. They are happy, they want to know more. What is it that somebody have to do to enter into business? Because we are all in, even those of us in a white-collar job, we still want to do something extra because we want to make it. So I'm very excited, and I hope that I'll use this opportunity to appeal for more sponsors, that our youth need to be educated more. As we want to talk about entrepreneurship, or create your own job or own your own business, there's more to it, to education and information.
Some of the participants lauded the organizers of the event and asked that the forum has provided them the opportunity to create their own businesses.
This program has really been informative in such a sense that some of us came with business idea, others had no business idea. But after this workshop, we've realized that when you have a business or business idea, there's a need for you to register the business. And the process to go about it, they've already informed us about that. And in addition to that, we have contact of other stakeholders that we can communicate with, so that in case of any challenges, we can go to them and they are willing to address the issues to us. So after this program, I'm sure that going out there, we are going to practicalize what you've done or what you've learned. And I can assure you that within the next 5 years, you have strong entrepreneurs.
My name is Asari Sandra, and this program is really educative and very informative, and it has really helped me a lot because I plan on doing a small business, starting a salon. So with this training and the kind of education given to us, it has really helped me a lot.
Reporting for Joy News, Anas Sabit, Techiman.
The accident and emergency unit of the Whole Teaching Hospital in the Volta Region has been experiencing serious congestion due to inadequate space. This development, according to management, is affecting healthcare delivery as the unit is unable to accommodate the number of patients who visit the facility. As the world marks International Emergency Day, Joy News' Fred Kwame Sari throws the spotlight on the challenges hindering quality health delivery and emergency services at the Whole Teaching Hospital.
The Whole Teaching Hospital, previously the Volta Regional Hospital, was established in December 2000 under the administration of the late Jerry John Rawlings. The facility, nicknamed after the contractor, Trafalgar, serves as a referral unit for other health facilities. Per statistics available, about 600 patients visit the accident and emergency unit monthly for various healthcare needs. The head of clinical services, Dr. Lord Mensah, lamented that the unit is overwhelmed by the numbers.
The place technically is too small. It was built to serve a regional hospital at that time, and now we have transited to a teaching hospital. The clientele base is increased. You know, we serve the Volta region, the OT region, and even beyond Benin and then Togo and Nigeria. So we have that population of patients coming. That means that the place is just too small.
Due to the high number of clients, the unit admits between 40 to 60% above its capacity, leading to congestion. Officials are compelled to treat patients in wheelchairs and beds at the entrance and in the walkways of the unit. There is limited space for staff to operate, impeding the delivery of quality health care.
As you can see, evidence-based, we see that currently the structure for the accident emergency is overstressed. Now, patients are being nursed both inside and outside. And the state of the hospital as compared to the structure we are having now, does not match. Looking at the bed turnover rate now, which is very high, people have been asking, why is it that always our mattresses are getting tall? And they don't understand. The turnover rate will tell you that at every minute, every seconds, people are sleeping on their mattresses. That is why when we buy the mattress, within 2-3 weeks, you see them Macintosh tearing off from the mattress itself.
There is an urgent need for the expansion of the emergency unit to accommodate the huge number of patients who visit the facility. This would help take the whole teaching hospital a step closer to achieving its purpose.
We have contacted some stakeholders who have agreed to support us with the expansion of the place. The expansion will come to give us that motivation to work adequately as health personnel.
Another disturbing development is the faulty incinerator. The air in the entire area gets polluted by fumes during incineration.
The whole environment is toxic. Fumes from the burning, the OPD emergency, and even go as far to the ward. So it means that we are exposing even the healthy one, including the patients, including yourself speaking, myself, into hazard. So we are working on that one too. We appeal to certain philanthropists to help us. Some of them started responding. So we believe that within the shortest possible time, we will relocate the incinerator from where it is now to a better place.
In commemoration of the International Emergency Day, there was a symposium to discuss factors affecting the effective delivery of emergency services and identify solutions to enhance it. Fred Kwame Asari, Joy News. Oh.
In Accra, in the studio, my name is Aisha Ibrahim. Let's take a break on Joy News Desk. When we return, there's more. Welcome back to Joy News Desk. Let's take you live to Nigeria, where Bola Ahmed Tinubu has been sworn in as president of Nigeria.
Bola Ahmed Tinubu do some and bear true allegiance to the Federal Republic of Nigeria, that as President of the Federal Republic of Nigeria, I will discharge my duties and perform my functions honestly, to the best of my ability, and faithfully in accordance with the Constitution of the Federal Republic of Nigeria and the law. That I will abide by the Code of Conduct contained in the 5th schedule to the Constitution of the Federal Republic of Nigeria. That I will not allow my personal interests to influence my official conduct or my official decisions. That I will preserve, protect, and defend the Constitution of the Federal Republic of Nigeria. So, help me God.
Distinguished guests, ladies and gentlemen, please a round of applause for the President and Commander-in-Chief of the Armed Forces of the Federal Republic of Nigeria, His Excellency, President Bola Ahmed Tinubu, as he takes his oath of office and sign the dotted lines confirming him as the new President of the Federal Republic of Nigeria. Thank you.
C'est le moment historique. Maintenant, la prestation du serment par son Excellence, le Président de la Nigeria, son Excellence Bono Tinubu, qui maintenant prête le serment. Maintenant, c'est la signature.
While the President is signing, just like her predecessor, we heartily welcome the 16th First Lady Federal Republic of Nigeria, Her Excellency, Senator Mrs. Oluremi Tinubu, wife of the 16th President and Commander-in-Chief of the Armed Forces, Federal Republic of Nigeria, His Excellency President Bola Ahmed Tinubu, an educationist, administrator, and philanthropist, Oluremi Tinubu, as First Lady of Lagos State, established the New Era Foundation, dedicated to establishing centers for all-round development of young ones and promote public awareness on environmental, health, and community service. Oluremi Tinubu has executed a lot of philanthropical acts to alleviate the plight of indigent persons, and most importantly, she has touched the lives of girls and women in her constituency. In recognition of her achievements and contribution to societal upliftment, Senator Oluremi Tinubu has been honored severally, both locally and internationally. Among these are the National Award of the Officer of the Order of the Niger, Ghana Noble International Award of Leadership, Gambia Diamond Award for immense contribution to the emancipation of people from poverty, many citations and chieftaincy titles. In appreciation of her contribution as a role model, the West African Women Association named the Oluremi Tinubu Women Training Center.
You heard the Bola Tinubu, now full president of Nigeria. Let's come back to Ghana, take a break, and bring you business shortly.
Hi, good morning. Welcome to Business. My name is Dr Kwadwo. Now, despite lifting the COVID-19 restrictions, President Kufuor says a 1% COVID levy will still be in place. He spoke at when he presented the state of our fight against COVID-19 Sunday night.
Let me make it clear that COVID expenditures, essentially unplanned, have been subject at my instigation to audit by the Auditor General and are going through parliamentary processes. We all deserve to be reassured that the crisis was not used as a cover for corrupt practices. The COVID Health Recovery Levy that was introduced to help fill some of the expenditure holes might not be the most popular tax, but I entreat all of you to bear with us. The COVID Trust Fund has performed an invaluable service, and with these developments has reached the end of its mandate. I thank the trustees as well as all donors and contributors to the fund. It is likely, God willing, that this will be the last in the series of fellow Ghanaian speeches on COVID.
All right, the president, during his address, mentioned that the IMF program is not a solution to our economic challenges. Meanwhile, the IMF has said that proposed tax measures introduced will not necessarily lead to the introduction of new levies. IMF resident representative Dr. Leandro Medina has been speaking to Joy Business.
The program of the authorities, as it was designed, it has a large and front-loaded fiscal consolidation. This will be done through revenues, revenue mobilization, and through expenditure rationalization. On the revenue front, this will be done through not only tax measures, but also administrative measures to basically broaden the tax.
And I wanted that clarification from you, because the perception from most people out there is that the fund program is going to push for tax increases, and that's where they are worried.
There's also another aspect of this, which is when you compare Ghana internationally, the tax to GDP ratio is quite low. So we really need to think, and hopefully in the context of the program we will get there, is to get to a more comparable ratios in terms of tax to GDP.
In other news, telecoms giant MTN Ghana is set to hold its annual general meeting tomorrow, where the telecoms giant is expected to offer new shares to shareholders in place of dividend payments. Here's more in this report.
This proposal will only materialize if MTN is able to get shareholders to approve the special resolution during its annual general meeting. It is seeking shareholders' blessings so it can pay them with additional shares instead of cash as dividend. So if this proposal is approved at the annual general meeting, then for instance, if you were expecting about 500 Ghana cedis as total dividend payment, its equivalent in shares will be paid to you by June ending this year. However, shareholders can only qualify for this if the dividend payment is at least 129 Ghana cedis or more. So why is MTN doing this? Or let's say, what are the expected benefits? Well, in the prospectus, the telecom giant says will allow them to retain that cash, which can be used as working capital. MTN also believes that it will increase the number of shares the shareholders can hold in the company without incurring the capital market-related transaction cost. MTN made almost 3 billion Ghana cedis in profits for last year, and it's likely to pay about 70% of this to shareholders. So MTN could be making some great savings if it's able to get every shareholder to subscribe to this offer.
And that's business. Thanks for watching, everyone.
And as I wrap up Journey's Desk this morning, my name is Aisha Prime. Log on to myjohnline.com. There's more of the news and updates of all the developing stories. See you again at 12.